Greetings everyone. Hello, my name is Dr. Kimberly Jefferson. I am a chiropractor. I've been in the field for about 17 years now. I also practice locally here in Biloxi and Gulfport. So I want to talk to you today about how chiropractic can be an option for pain management. And for those of you all who are tuned in, I definitely want to acknowledge you for your participation, for tuning into this event, because it definitely means that you're about progress. You want to make sure you get the right resources, and you're about not letting this define your life or take it away from you. I also want to recognize the caregivers of people with sickle cell disorder. I know, unbeknownst to you, I know what it's like to watch somebody be in pain and not be able to fully be with them there, or to feel helpless, to feel like you wish you could do more. So caregivers, shout out to you, the friends, all of you all who are supporting people with sickle cell disorder. So sickle cell, what is that? So to my understanding, it's definitely a blood occlusion disorder. It is a disorder with the hemoglobin causing the sickle cells to be, causing your red blood cells, to be shaped like a sickle. And that's a shape that will cause them to clot and to the cells to be very sticky. Yeah, just like that, like a half moon, a crescent moon. Like, yep, that's exactly what they look like. Thank you so much for the visual. But it causes it to get really sticky, and so those blood cells can coagulate or get caught up in your organs, in your lungs, and different bodies of muscles in your body, and that will cause you to have pain. And so sickle cell patients are usually going in and out of crises. There's fatigue, there's not knowing when the pain will come in, all of those types of difficulties that go on with it. So there are so many challenges that they face. This is why having a proper wellness team or health management team is important. You're definitely going to want an MD's intervention with pain meds on this cycle as well throughout your journey. So you have your MD, which can be your general medical doctor, or a specialist that can help you with some things, like some people have to go to orthopedics because they have knee issues, hip issues, shoulder issues, other spinal issues as well. Your physical therapist is a person that's on your team for pain management to help with dysfunctions in the muscle and in the joint. If you have to get rehab, if you have old injuries and things are just not as strong as they used to be, a physical therapist is great for that. And you also have something you may not have thought about is your mental health therapist. Your mental health therapist helps with pain management because pain also, there's a side of it that responds to your emotions in life, and life gives us all trauma. And trauma sits in your body. So working with a mental health therapist can also help you to ease through that process. So where does chiropractic come in? When the pain meds just aren't enough, like I said, I have a family member who experienced sickle cell, and I watched him go through so many episodes and so many different cycles of different medications and trying to lower the pain. And some of it just wasn't enough. Or what if you want an option because you want your body to work as best as it can, and you don't want to use a lot of medicinal, a lot of chemicals in your body? This is where chiropractic comes in. So back to the sickle cell and the sickling and how things can coagulate and add up in different parts of your body. That will cause you to feel the pain. The reason why you feel pain is because of a nerve. Your nerves go everywhere all over your body. And in order for your body to function properly, you need all those nerve endings, which your nerves go from your brain. It's basically a connection from your brain to the rest of your body. So that's how your brain and your body communicate all day, every day. And the feeling of pain is actually a gift, because if we didn't have it, we would consistently injure ourselves. Well, in this case with sickle cell, the pain is not so great because you're not able to focus, and it really dwindles your quality of life. And in order to have that, this is where pain management intervention comes in. So chiropractic is a holistic health profession that seeks to help decrease the pain. It helps reduce stress, helps reduce inflammation, increase your flexibility, and also your overall wellness. Chiropractors are trained to make sure all of your nerves and all of your organs are working properly. It's not just about the popping, as people say. A lot of people look at it as chiropractors pop joints, we're crackers, we're cracking things, and that's not true. So it's actually called an adjustment. So a chiropractor is professionally trained to locate any restriction in a joint in your body, and joints could be in your neck, in your back, your hip, or your knees, that will cause interference in your nervous system, meaning that it's not functioning and flowing correctly. So we're trained to go and find those restrictions and also stimulate the nerve in that area to promote healing. So we operate under the major premise that your body naturally heals itself. I was speaking to someone earlier and she was asking, you know, if I have to go to a chiropractor, don't I always have to go? I said, no, you can stop going to a chiropractor whenever you want. It's all about how much health and wellness you want to exist in your body. You will naturally heal from different ailments. Going to a chiropractor on a regular basis keeps your body functioning well, just like you would continue to put gas in your car, or that's just like you would have weekly maintenance things that you do in your house to keep your home clean and available for you to live in. Well, you can't live anywhere else other than your body, so you want it to function well. So that's what the purpose of the chiropractic adjustment is for, is to help in that area. What have I seen with sickle cell? So in my family, my brother-in-law had sickle cell, and we dealt with him. His name is Jerome. We dealt with Jerome with his headaches, with neck pain, with shoulder pain, with hip pain, low back pain, all of it. And Jerome had to be open and honest with me to share with me what goes on in his body. And he was just as much of a help to me understanding sickle cell as I was to him being his chiropractor. And not just his chiropractor, but his family member, somebody who listened to him with compassion. There were days when he couldn't come in for care. And I understood that, because there are days when your body is more sensitive. You may need more rest. Isolation may be something that is actually healing for you versus being out and pushing yourself into it. And so we would just encourage him to do what he needed to do for management of his pain. He did have to have some hip replacement, and chiropractic is not going to prevent a lot of things, because if there's already some sort of damage in the body already, that has to be corrected through surgical matters. And he responded very well to that. He was able to take it. He did have to have some blood transfusions as well. Many of you know what that process is like. Shout out to the blood donors here today who gave blood with that. If you're able to give blood, people with sickle cell greatly appreciate that, and many other people who have chronic diseases. So him being able to go through that process and not be in so much pain, and to have another way of coping with his pain, he expressed that he was very grateful for that. He did not have to have shoulder surgery. He had a past injury, and this is where chiropractic comes in and is gold. If you suffer some type of injury, you do not have to deal with that layer of pain as also the layer of sickle cell pain. You can do something about that to lower your pain and keep you from going into crisis. Or if you've been in a hospital and you've stayed for over 3 or 4 days and you're sore and you're achy, and you know your posture hadn't been all that great, I admonish you and encourage you to go see a chiropractor, and one who will listen to you to help you with those complaints that you're experiencing in your body. So Jerome also used his faith, and that was a part of his healing as well. He would write, he would have spiritual advisors and counselors, he would be open and communicate. That was one of the main things that I learned from him, and what I want to share with you as well is to be your own advocate. Make sure the people on your healthcare team are compassionate and that they're listening to you, because they're learning about you as well. We as doctors know about what's going on as far as what our textbooks tell us or what the research tells us, but personally, to live with that disorder is something we have to hear from you all. So being open and communicating helps everyone with it. And also, I would encourage you to seek chiropractic on your healthcare team as well. My name is Dr. Kimberly Jefferson. I practice locally here in Gulfport and Biloxi, and if you can, come by and see me.